The issue of patient selection for CAR T is an interesting one. Without a doubt, now that the product is FDA approved, people are using it in a broader subset of patients than was initially on the clinical trial. And that includes patients who are refractory, but with low-level MRD level disease. That's a very common use for Kymriah now. So I think that is an interesting aspect of patient selection. I think we all recognize that high disease burden is higher risk for toxicity, but I think we can treat those patients safely. But as doctors are referring for cell therapy earlier, we're seeing less and less toxicity. Yes, I believe that toxicity management has gotten better, but the main thing that's gotten better is earlier referral. And so that's a key part of patient selection. The other aspect that, we're using sort of autologous transplant-like criteria for these patients, decent organ function. It doesn't have to be pristine. Depends a lot on disease burden. So you can have a tolerance for a lower performance score or slightly off cardiac function if you've got a patient with low disease burden and a low likelihood of severe CRS, or that you may perhaps wouldn't treat that patient with a high disease burden because of the concern of significant CRS and perhaps limiting their ability to recover. So I think we're learning more and more about that aspect of patient selection as well.